A keen eye is being kept on the increase in respiratory cases in China. Chief Medical Officer Dr. Sharon Belmar-George notes that a confluenza virus is in circulation in that nation has been identified as the cause of the uptick in respiratory ailments.
The respiratory cases reported are due to influenza A, human metapneumovirus, mycoplasma pneumonia, and COVID-19. The Chinese Center for Disease Control and Prevention has not submitted an official report to date. The Caribbean region and St. Lucia is presently in the typical flu season, with notable increases in respiratory illnesses among the population.
This increase in the flu in the Caribbean and the wide coverage of China's respiratory illness crisis has prompted concern here in St. Lucia. The island's chief medical officer is advising individuals to ensure their health is safeguarded.
We note increases in influenza A, cases of respiratory syncytial virus, and COVID-19 variants. The human metapneumovirus is a respiratory virus that causes both upper and lower tract infections with an incubation period of 3 to 6 days. The duration depends on the severity of the disease. The symptoms include cough, fever, nasal congestion, shortness of breath, which may progress to a lung infection.
The Hmpv affects people of all ages, but more intensely children under 5 years old, the elderly, and the immunocompromised. Currently, there is no vaccine available to prevent against the Hmpv. In the interim, Dr. Belmar-George says the Ministry of Health has made efforts to strengthen its national capacity and a response for any potential spread from China to other countries. She says an increase in the disease surveillance system and the local capacity to detect and manage cases were crucial steps taken to do so.
The public is encouraged to reduce the impact of respiratory illnesses by the following measures. Maintain a healthy lifestyle through diet, regular exercise, adequate sleep, reduced stress and toxic habits. Ensure compliance by taking prescribed medication if you suffer from any chronic health conditions. Strengthen sanitary measures at home and at work and maintain proper hand hygiene with regular hand washing. Wear a face mask when presenting flu-like symptoms and consult a healthcare professional if flu-like symptoms linger or worsen. All persons with chronic health conditions are strongly advised to wear a face mask when in public, in crowded conditions, and avoid contact with others who are sick.
The Ministry of Health is urging personal responsibility, reminding the general public that St. Lucia is currently in the flu season, which runs from October to March, and encourages all to get the flu vaccine, available for free at the various wellness centers. Lucia Alfred, HTS News Force.